Sisters, brothers, thank you so much. Thank you. Thank you. Thank you so much. 100 years ago, this coming February 28th, this IAFF of yours, ours, was born. During the 3 days of the inaugural convention, there were 36 delegates from 32 locals, including George Richardson, the delegate from Local 18 right here in Vancouver, who debated and agreed to our name, the International Association of Firefighters, joining together to form our union. The first per capita of 6 cents was established, and the first constitution and bylaws were adopted to institute the governance and the core mission of this IAFF. And none were more important than Article 2, Section 1, which stated in the objectives, and I quote, fostering and encouragement of a higher skill and efficiency, the elevation and improvement of morale, social, and economic conditions, and the commitment to the duty of protecting our members. In those early days, most of our founding brothers at that time were on a single platoon continuous duty schedule, living in their firehouses, getting time off to maybe grab a bite to eat, and maybe an occasional day off. You know, their jobs were dangerous at that time, but unlike today, there were little or no training standards. There were no safety officers, no 2 in and 2 out, no two-way radios. Their turnouts were rubber coats, and if they were lucky, maybe rubber boots. Respiratory protection was a wet cloth placed over your mouth. And fighting fire meant you were blowing the soot out of your nose, and you were hacking up the black garbage from your lungs. Being a firefighter at that time wasn't looked at like it is today. It was thought of below blue collar. It was thought of as an unskilled labor. The average firefighter making maybe, if they were lucky, 29 cents an hour. And getting on the job, more often than not, came through mostly patronage appointments. Pay raises, promotions, and other benefits came at the whim of politicians. All of that is why they came together to form this international union. And while firefighters in many cities across 2 nations had local unions, the resources and knowledge of how to leverage the power structures that determined their fate was minimal. And they spent over a decade, from the early 1900s, attempting to build an international union that could make a real difference on the bigger and broader issues that affected their profession and their lives. And so from those earliest times, today, this IAFF, now with over 3,300 local unions and over 306,000 members, has been leading through innovation every day since. Building on the efforts of those who came before us, who laid the groundwork to improving our job and began turning it into the proud, highly regarded profession that it's become today, we've been focused every step of the way on our core mission to improve our members' standards of living and quality of life. And when it comes to their safety and health, in every way possible, this union has led the fight. Politicians, government bureaucrats, city managers didn't just decide to fix things for all of us. We have followed our forefathers in this union and the sacrifice of the lives of thousands of our members who toiled in the treacherous, untenable conditions to force the change that was needed to get where we are today and where we're going tomorrow, pushing for the new standards, codes, apparatus, equipment, personal protective gear, and training. And all of us together, in more recent decades, have worked for the passage of the presumption laws for heart and lung and cancers, now working on the behavioral health issues that were overlooked for so long, and moving forward on our pursuit of post-traumatic stress presumption coverage. And while recognizing our major achievements is something I want to do this morning, I do want to take this first minute to shine a light on a major victory that was announced during our last Canadian Legislative Conference, an achievement that took incredible teamwork between our staff in Ottawa and our affiliate leadership all across Canada. A 24-year effort that culminated with the Canadian Prime Minister, Justin Trudeau, joining us on the steps of Parliament Hill to announce this last April 11th the establishment of the Public Safety Officers Compensation Benefit in this country that will now finally provide a $300,000 benefit to the families of our fallen. Congratulations to all of our Canadian leadership on a job well done. It's been through these past few decades that this IFF has continued to lead through innovation in so many areas, to advance the skills, the policies, protections, and protocols that have improved our members' ability to enhance public safety as well as the safety of those we are charged to serve. We've been at the forefront in promoting and maintaining situational awareness of the all-hazards response our members are tasked with today. An environment that is changing every day with terror attacks, active shooter incidents, the opioid crisis, the growing wildland-urban interface, civil unrest, illicit drug labs, and the list just goes on and on as it continues to grow. And the need to recognize the severity of these dangers is great, which is why we continue to insist on and provide the training you need as union leaders, so you can go back home and ensure that your members, our members, are prepared to face the unexpected at all times. As our founding fathers envisioned in Article 2 of our union's Constitution, we have been, and I quote, fostering and encouraging a higher degree of skill and efficiency, end of quote, by incorporating additional skill areas that enhance our members' jobs, making them more indispensable to the citizens of their communities. The standards and protocols that this union has taken to lead in fighting for not only saving lives and property, that also help insulate our members from the ill-advised command decisions and short-sighted government leaders who would choose to decrease staffing, close stations, brown out companies, privatize EMS, and put our members and the public in more jeopardy. And one of the groundbreaking additions to our profession's work and mission was recognizing and then fully embracing the value of fire-based EMS. It wasn't that long ago, prior to the 1960s, where we essentially had a single service industry of only fighting fire. But then in the mid-1960s and the early 70s, we began our journey to understanding the power of enhancing our members' value by adding EMS skills. For many of us in those early days, we were resistant to that idea, but we evolved to, should we do it? And then believing EMS skills, it might be nice to have, to the true understanding we have today that it is an essential service required to keep our community safe and our members working. And it was right here in 1992 in Vancouver when this IAFF at convention formally and fully committed by convention resolution to move our profession into the fire-based EMS delivery world. It was our 12th District Vice President Emeritus, Dominick F. Barbera, for whom this EMS conference is named, but unfortunately can't be with us here this week, who led the way, had the vision, and saw the importance of moving to an integrated fire-based EMS system. And since that first EMS conference, when 15% of our departments ran a fire-based system in the United States, to today where more than 85% encompass fully integrated EMS delivery, this union has led the way to clearly establish that fire-based EMS saves lives and saves jobs. And here in Canada, where EMS delivery, by leveraging existing fire department resources, has developed more slowly, we're so encouraged by the great work that's now being done in Winnipeg, Alberta, Ontario, and now right here in British Columbia. So we continue to push the envelope to secure this safer, better fire service model. And while we still have a few departments resisting the change, and we do, and while we still have some members that are not fully convinced that this is something they should be doing, and while we still have conflicts with the private EMS companies and face representatives of some single-role EMS workers here in Canada that are up in arms over what we're trying to do, we're working to build on our EMS success, knowing there is no other system that compares to a fire department's ability to provide effective, timely, highly trained, and efficient pre-hospital emergency care. And another fire response area that's seen explosive growth is the fast increasing wildland-urban interface environment. As suburbs, we're watching and exurbs that are spreading into the forest to meet the ever-increasing housing demands of today's society. We know that most fire departments are 2 decades behind in understanding the unique challenges and response needed in this new environment. So this IAFF has stepped up our focus and commitment with the creation of our IAFF Wildland Firefighting Safety and Response Department. We're developing and providing our affiliates with the awareness, training standards, protocols, and the tools they need so that their members, your members, can safely operate in a wildland fire emergency. And only one has to look right here in British Columbia, with the smoke hanging over the city as we meet. Over 840 wildfires since April 1, over 6,000 people evacuated, over 300 structures already destroyed, to understand the significance of this new environment and the environment that our members are facing. And all of you are responsible to help make sure that we deliver the goods to allow them to operate in this new environment safely. And again, I refer to Article 2 of that founding convention of ours, which stated that this union's mission was the duty to protect our members. And that's become the heart of our health and safety operation. And one of the more recent and significant programs we've developed based on that mission is to prepare our members to be able to handle themselves when they get in a tough spot on the fire ground. And no work in the arena has proven more important than the development of our Fireground Survival Program. An incredible program that goes to the heart of allowing our members to keep themselves safe. Every one of you in this hall knows that there's no event more frightening to the fireground operations, and there's no radio message more dreaded than the Mayday call. And without question, this union's Fireground Survival Program is the most comprehensive training in the fire service for when the unthinkable moment occurs, when everything so quickly can go to hell in a handbasket. And now we can proudly attest that 40,000 IAFF members that have been certified at the Fireground Survival Awareness level are able to now do so and help to expose to 99,000 plus firefighters this life-saving training. Nearly 1/3 of our entire membership now receiving that training. And we're just getting started with this program because so many of our departments, and I was so thrilled to see our mobile unit out there today and so many of you engaged in the training exercise, because what we know is that we have departments that simply don't have an academy. And they likely don't have the capability of purchasing the terrific permanent FGS props. And so what did this union of yours do? We said, we've got to find a way to bring this training out to our members. Bring this life-saving training by mobilizing it. And that's exactly what we did. And we deployed the first 2 mobile units in 2014, one on the East Coast, one on the West Coast. Today, there are 19 departments in 9 states and 3 provinces operating our mobile units, including the newest unit that was delivered right here in Vancouver, outside of this hall, that was part of yesterday's pre-con. And now it's going to be deployed all across British Columbia. Our ultimate goal, simple, to expand this life-saving training so that all of our members, wherever they are, wherever they work, will be able to experience it. and be in a position to save themselves when that time comes. Also this week, we'll provide an update to another groundbreaking program, an industry standard that this IFF led on 2 decades ago. It was 1996. The Wellness Fitness Initiative was then developed by this IAFF. In a little over that 2 decades, we believed in, and even more today, that an effective wellness program that includes a comprehensive medical exam is critical to helping those in our profession to become physically fit, emotionally fit, and mentally fit. A program that allows them to better cope with the extreme nature of the incidents they respond to is central to their overall health and ability to finish a career and enjoy a well-deserved retirement. So you'll be getting an overview, as Pat said, of the latest updates on WFI as we ready ourselves for that publication of the 4th edition due out this fall. And our health and safety innovation also encompasses the development of our peer fitness training effort to teach and educate our members, all of you, on how to eat right, how to work out safely, using the latest research on firefighter health and wellness, exercise science, and injury prevention. Our goal is and has been to teach a number of our members to become fitness trainers, and to date we have 8,338 certified within their departments, allowing us to spread these critical skills and knowledge all across this international union. And on a more somber note, next month, as the video indicated, we'll all be gathering in Colorado Springs at our IFF Fallen Firefighter Memorial. We'll be etching the names and stories of 196 of our own into those beautiful granite walls. And while this union has led the way in raising awareness, prevention, and treatment of the scourge of cancer in the fire service, it is alarming to note the sad fact that 152 of those names are from cancer, with 13 of those from the World Trade Center exposures. And so as we do with so much of our work, we are leading on the issue with multiple strategies. We are and have been engaging in the studies to determine how are our members being exposed to the deadly carcinogens that make up the toxic soup and the poisonous environments that you and they work in, created by the synthetics and composites and new artificial materials that are used in today's living and building settings. We know from the fire station dust studies that much of the exposure is coming from our turnouts that you're wearing in a working fire, then throwing them in the rig afterwards. We're learning more and more that even after the exposures on the fire ground, that we've been the carriers of bringing those toxins back into the stations and living quarters. So we've been leading in the way to develop the SOPs and protocols that are going to require and are requiring bagging up those turnouts and beginning decon right on the scene. And from a PPE perspective, we're continuing to look at how can your turnouts become better constructed from better fabrics to see if we can create better seals and protective equipment, including hoods and gloves and SCBA. And to help you install the best practices in your department, we've created and launched the IFF Online Cancer Awareness, Education, and Prevention Program, another tool to start reversing this disturbing trend. And when it comes to standards, we have placed a high priority on pursuing legislative solutions, taking on the chemical industry. We're taking them on, head on, to control the amount of flame retardants used in our society's furnishings, building materials, coverings, applications that are clearly responsible for much of the crisis and cancers our members are experiencing. And so congratulations to the state of Maine, who passed the first bill to prohibit flame retardants, only to see it and have it vetoed by an ill-advised governor, but they were strong enough and capable enough to have that veto overridden by the House and Senate, ushering in that new law. Maine, great work helping us on the path to a new legislative fix. You'll also hear more about our latest efforts to establish new presumptive coverage, building on the laws already in place in 36 states, 8 provinces, 3 Canadian territories that recognize many cancers as job-related, affording those stricken with the benefits and protections that come with other job-related injuries. And on the federal level, starting with the United States, we now expect the passage of our National Cancer Registry to be signed into law by this early fall. And as we always try to stay in the forefront of emerging opportunities to provide cutting-edge care for our members diagnosed with cancer, yes, you'll be hearing much more today about the newest and most incredible diagnostic and treatment tool, GPS Cancer. And you'll hear it from our partner with Cancer Initiative, NantHealth, who we're so proud to join in trying to address this serious problem. And to emphasize our awareness and commitment on this critical front, we are also going to be holding a cancer summit that's going to follow ALTS this coming January 2018 in Orlando, Florida. You'll be hearing much more about this summit. Now, I know I could go on and on with the extraordinary work this union is doing on so many health and safety and EMS fronts. But I want to make sure that we all focus now on the issue that has truly emerged as nothing less than a crisis among our ranks: the behavioral health challenges our members are experiencing. The tragic truth is that our members with post-traumatic stress are 6 times more likely to attempt suicide. It's painful to think that so many of our sisters and brothers feel that their only way out of the troubles they're experiencing is to take themselves out. Now, I'm not trying to be dramatic or ghoulish or insensitive, but the cruel fact is, and so many of you know it, is that we have far too many of our members whose despair is so deep that they feel they have no other options left than pulling the trigger, hanging themselves, taking their lives in so many heartbreaking ways. It is now at epidemic levels. And as leaders, it is our duty to address this in a bold, new way. You and I know that we have many in our ranks that are struggling. They're struggling with alcohol, and drugs, and gambling, and other destructive addictions. They're experiencing failed marriages and relationships, and too often taking out their silent injury on their family, or maybe their children at home. As I've been traveling across our 2 countries over this last year, I've spoken about that injury. I've spoken about it a lot. It's an injury that until the last couple of years, quite frankly, few of us wanted to acknowledge or talk about. You and I know our members. I know all of you. You don't like to admit that the guts and gore and the tragedies and traumatic incidents that you encounter ever bother you. No. You're all tough. You all cover up your pain by simply stuffing it down, and maybe masking it by using old firehouse humor. But we now know that so many are likely hurting and need help. And I suspect that includes some of you right here in this room. Oh, you're all great with broken bones, burned ears, lacerations, pulled backs, busted shoulders. But how are you dealing with that silent injury? One where you experience emotional and mental pain. And unfortunately and historically, our profession has been responsible for creating a stigma around this pain, around what we refer to behavioral health concerns. We made it tough for a sister or brother to come out of the shadows to ask for help because they probably would fear ridicule from their own, from their crew, who might think that they're weak or just can't take it. Or maybe they fear discipline or termination from the job by their chief. Well, that way of thinking is prehistoric, and we have to end it right here and right now. So your union, this IAFF, is once again leading the way through innovation, working hard to eliminate the stigma through education, information, training of peer counselors, development of peer networks, and new procedures that recognize these conditions as an occupational injury. We are refusing to refer to this any longer as a disorder. It is an injury like every other occupational injury that unfortunately you and our members experience. And as we have with cancer, we've also taken a multifaceted approach to address this new challenge, starting with the development and the deployment of our online behavioral health awareness and educational models, followed by the implementation of our IAFF peer support training. Training developed for our members, by our members, creating a team of behavioral health counselors among our ranks. This new structure enables our trained members to identify a crisis, approach a sister or brother, and establish the trust and confidentiality and confidence needed to get that member help. Training that is designed around the idea that our members are much more inclined to discuss their personal challenges with someone from the job rather than being sent off to a psychologist or a psychiatrist. And again, using the political and legislative process, we're supporting our state and provincial affiliates in their efforts to pass post-traumatic stress presumption legislation, with Canada again leading the way, where we now have presumption legislation in 5 provinces. Just incredible work in such a short period of time. And now with Vermont, the first state in the United States, we're leading our union down the path of securing this critical benefit protection across both countries. Work that all of you should be very proud of. And once again, continuing to lead with our new partnership with Advanced Recovery Systems, trying to think out of the box, trying to be creative, trying to figure a way, how do we directly and more directly help and take care of our members? And so we opened up the very first occupational specific recovery facility with the establishment of the IFF Center of Excellence for Behavioral Health, Treatment, and Recovery just outside of Washington, D.C. Your center now has served over 106 members from the United States and Canada in just its first 5 months, with 79 graduates who have finished their program, culminating in a special ceremony in that Renewal Plaza that you saw on the video to celebrate their going home on a path to renewed health. Your center is the only one that's for IAFF members only, so that they can receive the help they need by the best medical and clinical teams, trained to know what you go through on the job, in an environment that feels like home, with a focus on substance abuse, addiction, as well as the only center to admit our members with primary mental health issues. And as a new recovery and treatment concept and facility, we're still working out some of the wrinkles. Yeah, we are. We're trying to address some of the insurance issues for full inclusion. We're trying to make sure that it's in-network coverage. We're working on the deductible and co-pay issues. And admittedly, this process has not been without some growing pains, but we are continuing the hard work necessary to ensure that we successfully expand. And in the future, we are going to be building more centers out across both countries so our members can have easy access to the very best of care. So that we will be pushing forward now with our commitment to peeling back the resistance and the ignorance surrounding this critical health issue, the kind of work that would make the founders of our great union so proud. And that's why we're not going to stop until every member is able to be identified that they're in crisis and know that their union, this IAFF of yours, is going to ensure that they get the help they need and the help to help them heal. That's our responsibility, and that's what we're going to be delivering. In closing, I promise you that together we will continue to be forward-thinking, always pushing, always innovating. At this, the 24th Redmond Symposium, the first of which was held at the University of Notre Dame in 1971. And this 14th EMS conference, the first held in Seattle, Washington in 1991. We remain totally focused on delivering to you, our leadership, the best information, instruction, and education on the cutting edge of the ever-evolving issues that go to the heart of our members' profession, their safety, and their health. You'll learn how we're using the power of big data in our fire care system so departments all across North America can use this critical information to help tell the story of the risk that our members face and the resources they need to better serve our communities and to keep them safe. You'll see how we're embracing technological advances that are enabling our members to face the new and evolving hazards on the job, whether it's drones, dealing with solar panels, nanoparticles, or lithium batteries, to adjust our strategies, our training, our standards, and resources to keep them safe and healthy throughout their career. For just shy of 100 years, we've been making a difference in our members' lives, whether it's using the political arena to elect lawmakers who are willing to work with us, or getting rid of those who don't give a damn about firefighter safety, whether it's working with the science and academic communities to develop the fact-based information that we need to improve the standards and protocols, or whether we are partnering with those in the private and corporate community who are willing to invest in our members and give them another lease on life. We have a strong record of a century of progress through unity, and I promise the same kind of unity and progress as we continue that work and enter into the next century. I commit to all of you that your union will continue to lead, continue to innovate, continue to create. We will adapt. We're going to make a difference, and we'll always be doing it together, sisters and brothers in arms, on behalf of the very best that our nations have to offer, the men and women of this IAFF. Stay safe. God bless. Let's have a great conference.